Welcome to today's Practice Advantage Pearl. Today, we'd like to talk a little bit about what's real. What is perception versus reality with your practice? Practice Advantage has had the good fortune since 2005 to use a self-assessment tool to help practices really get at what is perception versus reality when it comes to the total practice. 750 specialty groups across the United States have participated to date. It's a simple yes-no survey done at a high level on a 6-point scale, meant to only take 3 to 13 minutes to do with key staff. The 6-point scale is meant to really be a discussion starter, an opportunity for the practice to really dive a little bit deeper into some areas that might require some conversation. We've broken these apart into leadership and governance, planning and marketing, business and clinical operations, finance, human resources, information management and compliance, and risk management. Now, on that 6-point scale, leadership and governance tends to be, for the 750 plus, a 4.2. So leadership and governance considered to be fairly good in that. The lowest self-score is in planning and marketing, a 3.0. Now, why might that be that practices are rating themselves lower in planning and marketing? If I think about it, it's because they're busy seeing patients, they're on the treadmill of day-to-day clinic and business operations, and taking time to really do some thoughtful planning may not be the easiest thing to do. Next is business and clinical operations. This one scores about a 3.8. This is where there may be some opportunities embedded in the practice to be a little bit more efficient, to make sure that there's adequate access to the practice. Patients aren't waiting 3 months to get in. They're not waiting 3 weeks to get in. There's a reasonable amount of time before they can access the practice. Financial management self-rates at about a 4.1, which is again pretty good, but some opportunities there as well for revenue cycle management and some things like that. Human resources typically rated amongst the highest of a group. Now, why might that be? Related primarily to if it's a leadership team or a physician rating, they may think about the people that they work closest with. So the physician, it might be the nurse practitioner, or the MA, and you know that that person is really the best in the practice. So typically a pretty high rating. Great vote of confidence for the staff. Information management rates a 4.0. That's related to a lot of change in the marketplace. And lastly, it's compliance and risk management at 4.2. Obviously, opportunities there because the landscape is changing. Probably every 6 months, there's a new requirement that comes out from CMS or other entities that are regulatory for practices. I'd like to invite you to think about taking the self-assessment. It's conveniently on the Medtronic Practice Advantage website. It should only take you that 3 to 10 minutes to complete, and then you can benchmark yourself easily against the others. The other piece to that is I'd encourage you to use other people in the practice to take a look at the variability that might come around one particular domain. Maybe people in the group are thinking that finance is doing really well with the exception of 1 or 2 people in the group, so you can talk about why their perception is a little bit different than others. Thanks again for joining us for Practice Advantage Pearl. We hope that we will see you on our website and at future Practice Advantage Pearls. Have a great day.